Welcome and hello to the almost 400 people that have kindly registered for this event. We're super excited to present Dr. Robert Melillo today. My name is Dr. Carla Renato. I'm the Clinic Director of Brain Hub, which is a multidisciplinary practice here in Sydney, Australia. We're fortunate to be one of few practices that are certified in the Robert Melillo method, and we're greatly appreciative of being able to help and use his programs to help many people throughout Australia. In 2022, last year, we brought out Dr. Melillo for a 5-day event in Sydney. It was a practitioner-only event, and what we found is there was a huge calling from parents and caregivers and patients to say, look, we want to be connected as well. So I've been able to wrangle him back for an event in November this year. It's a 5-day event. 4 days are aimed at practitioners, but we've been able to get 1 day for parents and caregivers. And I think this is going to be a great opportunity for many parents to be able to ask questions, to learn from his research, his extensive research, from his books, from his videos, and really to connect to the person himself. So that's going to be super exciting. At the end of today's webinar, we'll have an opportunity to discuss how you can be involved and how you can secure your seats. We are selling fast on those tickets, but we do have some available, and there'll be some great incentives for you today as well. But you know what? I don't want to take up any more of Dr. Melillo's time, so I'm going to hand over to a colleague of mine, a friend of mine, Dr. Robert Melillo. Welcome to the Australian audience.
Carlo, well, thank you very much. I'm excited, really excited to be here. I can't wait to come in November, and I can't wait to see you again, my friend.
Pleasure. Thank you.
Okay. All right, let's jump right in here. And first, I want to just thank you all for being here. I hope I get a chance to see you and meet you in person. Why don't you just give me a little shout out as far as what city you're from and where you are in Australia right now? I'd love to hear that from you, or see that, or read that. Just put in the chat box there what cities we're talking to. Okay, Gordon, gotcha. Michelle, okay, and Lauren, okay. Okay, Western Australia, Perth, Nelson Bay, Sydney, Wyndham, Melbourne. All right, Sydney, Gold Coast, Perth. Okay, fantastic. All right, well, let's get moving forward, and let's start looking at some of the things that we want to talk about, as far as looking at first a big question, which is why neurodevelopmental conditions are on the rise in Australia and what you can do about it. One of the things that I found early on, this was years ago, I'm talking about maybe 15, 20 years ago, and I really was doing a lot of my initial work and looking at putting together my first book. I saw statistics that were actually from Australia, and they were actually equal to or worse than what we were seeing in the United States. And at that point in time, the United States seemed to have primarily the highest statistics when we looked at ADHD, when we looked at autism, when we looked at all neurobehavioral disorders and looked at, the full spectrum of it. The United States typically had the highest numbers. There were other countries around the world as well, like the UK, Japan. These are just a couple of countries that had very, very high statistics even early on. But Australia was right up there. And basically what we know, and in my third book I wrote, which was called Autism, the Scientific Truth of Diagnosing, Treating, and Preventing Autism Spectrum Disorder, I really spent a lot of time really researching that and looking at the factors that are leading to this. First of all, the first chapter is, are we actually facing an epidemic? And the answer really is clearly yes. And this has been going on for a while. To give you an idea, in the United States, the statistics 30 years ago were 1 in 10,000 kids had diagnosed with autism, and now it's 1 in 36 or 1 in 24 boys in the United States. Recently, there was an MIT professor that came out and said that she believed, based on her research, that by 2025, 50% of kids in the United States would be diagnosed with autism. Those are huge numbers. And the increase is so dramatic. And one of the things that we showed in the book is that really it has mostly to do with lifestyle factors. What we know is that it's not primarily due to genetic mutations. That is very rare, in fact. The idea that there's one gene mutation or even a few genes that are mutated or altered physically that is actually causing this rise is just doesn't fit. There's no such thing as genetic epidemics. Also, the vast majority of parents and siblings in families of kids with autism do not have a diagnosis of autism. So therefore, again, reduces the idea of it really being passed on because of a genetic mutation. But what we do see is what's called epigenetic transmission, which means that there are genes that are altered in their expression, and this is really based on environmental factors. And we know that these environmental factors are not just impacting the children, but they're impacting more the parents and also generations of parents before that. We know that what we call epimutations can go back 11 generations at least. And what it does is these different factors that are in the environment. And in my book, I identified at least 50 that are well known. I just commented for a major news channel here the other day on a study that was done, a very good study, looking at the use of aspartame, which is essentially NutraSweet, that is used in diet sodas. And it was shown that if pregnant mothers are drinking that it elevates their risk of having a child with autism significantly. And again, this seems to have some relationship to the fact that it's altering the balance of excitatory and inhibitory networks in the brain. Glutamate is the primary excitatory neurotransmitter. Glutamate is a byproduct of aspartame, or aspartate is something that is a precursor to making glutamate. And we also know that the left hemisphere tends to be more excitatory and therefore more glutamate driven, whereas the right hemisphere is more related to GABA or inhibitory neurotransmitters and inhibitory functions. And these imbalances can be influenced or affected by environmental factors. Australia, what we see is very similar in lifestyle to the United States from a standpoint of there's a certain level of affluence. What we've been able to see is that as we move more and more into a technology world, we're moving more and more into a left brain type of world. What we see in autism and in most neurobehavioral disorders, which is not, when we talk about ADHD, OCD, tics, Tourette's, we see a lot of right brain deficiencies with overactivity of the left hemisphere. Learning disabilities like dyslexia, processing disorders, and even things like bipolar disorder are the opposite of that, where we have a high right brain and decreased left brain networks. But what we see is that this imbalance is often influenced in great part by motor activity and movement. And what we see is we've been moving more and more towards a sedentary society, focusing more on looking at technology. The technology itself drives the left brain more than the right. The left brain is more technically driven. It's more relies on input that is short-term, focused attention, reward-generated type of behavior that we see from video games, and even from many different computer-based programs. So what we see is that sitting or spending more time not moving is having a huge impact on brain development. It's having an impact on our overall health. So the same factors, environmental factors that are driving obesity, diabetes, heart disease, cancer, these same factors are also driving changes in brain development in the womb and outside the womb. And this is effects that affect both men and women, moms and dads equally. And they really change the way that the brain, what we call functionally connects, or the way that we form connections in the brain early on. And it affects the maturation and maturational development and growth of the brain. The good news is that, we've been doing a lot of research over the past 4 or 5 years. And the main subject has been looking at what we look at as retained primitive reflexes. These are reflexes we're all born with. When a human baby is born, we are the most immature brains on the planet of any animal, because we, of all primates, we have the largest brain and we have the smallest birth canal. So when human babies are born, they're incredibly immature. The brain is only about 20% of the adult size. And so we have to restrict the growth in the womb. And as soon as the baby is outside the womb, they're bombarded by sensory input, and that helps to stimulate genes that help to grow the brain. But when we're first born, to really engage the world in the senses, we need to be able to move, but we don't really have a mature brain. We don't really have a mature motor cortex. So a child can't move in any sort of volitional or purposeful way. But they need to be able to do things like root and suck and grasping reflexes, and reflexes that may cause them to turn or twist, that even help them to get themselves out of the birth canal themselves. And these reflexes that we're born with early on are called primitive reflexes. We've known about them in neurology and neurodevelopment for over 100 years. They're part of a traditional pediatric medical neurology exam. But the thing is that they only look at that for the first year of life. In normal circumstances, by the end of the first year, the reflexes will become inhibited or integrated. And that also allows the brain to mature at the next stage of development. But what we've been able to show in my research and the research of others is that many times those reflexes do not go away. And what they do is they cause an immaturity of the brain. The reflexes normally go away with maturation. If they don't go away, it means that the brain is not maturing at the way that it should. And also, many times these reflexes may be retained in a asymmetric, more on one side or the other, which they never should be. And this represents a developmental maturational imbalance between the two hemispheres and between different networks, starting in the brainstem and working its way up. And it interferes with that, what we call vertical integration, going from the bottom up in stages, and then the brain grows, and then it comes down and it regulates everything, and it ultimately shuts off those primitive reflexes. We know that if we have a brain injury later on in life, or with dementia very late in life, that many of these reflexes will return. So we know that this is a normal developmental process. We've been able to do research now. We published 7 papers alone in top tier journals this year on looking at retained primitive reflexes, their relationship to autism, functional connectivity. And we showed that there is an impact on brain development. There's an impact on brain connectivity. There's an impact on the way that the brain communicates, and that the way it regulates even the autonomic system, the heart rate variability, the digestive system, and the immune system. And all of this is really because we are not able to move in the most appropriate way. When we move, we not only have to go through milestones as we're developing, but it's also the quality of that movement. And if we're doing the movement in a proper way, which is ultimately what causes these reflexes to become integrated. And therefore, if we're not moving in the right way, if we're not moving in the most appropriate way, we may not integrate these reflexes. And then they can be the primary driver of these network imbalances that we see And that is really the explanation of most of the symptoms that we see. So the reason why we see in Australia, in the United States, in the UK, in Japan, and really in most of Europe and really most of the world, in any week you could be in my office and we have patients from all over the world. I mean, we have patients from Australia right now, New Zealand, we have patients from Ireland, from the UK, from China, from South America, Chile, all over the world. And so this is a worldwide global problem. As the world becomes more technology driven, as the world becomes more, people become more sedentary, as we start eating more processed foods, we increase inflammation. And then that alters the way that the brain develops. And then if the brain isn't developing, the brain doesn't regulate the body and its systems. And all of this feeds on itself. So this is why Australia is, one of the leading places in the world right now. And we see that, this is one of the issues. So the next question is looking at, what else and why now are we seeing this? And as we said, this is really because we are seeing changes. Ian McGilchrist, who's a very well-known psychiatrist out of the UK, has written a number of books, and recently he's been doing a number of different lectures, and he talks about how our world is moving towards a left brain dominant society. And the right brain really is the side of the brain that is really more emotional. It's more socially driven. It is more empathetic. It's more moral. It has a sense of right or wrong. It wants to connect to people. It wants to be emotionally attached. It's connected to our own body. It's connected to nature and the real world around us. And its primary drive is really to build social relationships. It has a big picture view of the world. It looks at the context of things, isn't just, focused on the details, but rather is able to see the big picture. And the right brain has a wide array of emotions, and pretty much almost every emotion that the left brain has, the right brain has, except for one, which is really primarily anger. The left brain is really more disconnected from our body and our own emotions. It's disconnected from other people. It is more interested in inanimate objects. It lives more in a virtual world, not reality. It's not really interested in nature. It loves technology. It loves familiarity and doing the same thing over and over and over again. And the only emotions that really is purely left brain is anger. We also see that joy and happiness is primarily left brain, and pride as well. But we see that we live in a world now where we see more disconnection amongst people. We see that people are less separated along different things like party lines or political lines or whatever. We see that people seem to be less empathetic, that they're more looking at at details of a content rather than being able to look at the context of things. We see that we're also more angry, and anger is the main emotion you see today. And these same factors are having an impact on literally the development of the brain itself. In the in the countries that are most advanced technologically, we see that we have more issues with neurobehavioral disorders as well. So Australia is up there as one of the main reasons. And this is the reason why this is happening now. And there are ways to reverse this. One is just awareness, being aware of what is driving this. And most of these environmental factors, the good news is that most of these environmental factors, we can modify, we can change, we can alter after the fact. So whatever produced the issues, whatever epigenetic factors or environmental factors may have produced this imbalance when the child is born and as they're developing, the good news is we can identify those environmental factors. We can modify them before pregnancy, during pregnancy, after pregnancy. But more importantly, there is no damage in the brain. There is no injury in the brain. There is no genetic mutation most of the time. There is no metabolic disorder most of the time. So in most cases, we can change the brain. We can resolve these issues. We can address them after the fact. And so there really is nothing holding us back other than the knowledge of how to do that. And that's what I've devoted my life to. That's what I've devoted over 30 years to. One of the things, if you have checked out any of my Instagram posts of late, and you'll see that, one of the first questions I ask parents, and one of the things I want you guys to answer for me now, actually, is if you have a child or if you are a person who struggles with some sort of neurobehavioral issue, whatever that may be, whether it's, ADHD or OCD or tics or Tourette's or a learning disability or autism or dyslexia, or bipolar or schizophrenia or just severe anxiety, which is epidemic as well. Has anybody ever really explained to you what is happening in your brain or your child's brain? Answer me right now. How many of you would say yes, and how many of you would say no? Has anybody ever really explained this to you? No, 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 not clearly. No, only one. No, no, no. Dr. Carlo. And yes, no, just you. So again, I'm going on and on. I'm reading your responses, and they are almost all no's. And that is what I get when people come to me. They've been all over the world. They've seen people that are supposedly the best in their field. And I ask them that simple question: has anybody ever really explained to you what's happening in the brain? And the answer is no. And then I ask them why. Why do you think that that is the case? Let me see some of your responses. Why do you think nobody is explaining? You get a diagnosis of autism or schizophrenia, and they never explain to you. They don't know. They don't know. They don't know. You're right. That's exactly the answer. They don't know. And so one of the things when I was a parent, the reason why I got into this is really because in 1995, I came home late at night from a long day in practice again. And my wife was sitting at the kitchen table with a woman, and she was crying. And I said, to my wife, what's going on? And she said, I want to introduce you to Denise. She is a son who has ADHD and some other issues. And she's been doing all of these things. And I went to a fundraiser at her house last night to raise money for an organization that she started. And she's here because I told her that you know a lot about neurology, you know a lot about the brain, and that she was looking for alternatives because all of the traditional things she'd been looking at hasn't done anything. And I figured maybe you could help her. And I said to my wife, I took her aside and I said, I understand what you're doing, but I'm already coming in kind of late here at night, and I'm busy and I'm lecturing on weekends, and we have 3 little children, and you really want me to do something with this? And she said, I think you're supposed to do something with this. I have this feeling that you're supposed to do something here and help this woman. And I said, all right, I'll do what I can. And I didn't really know what these issues were. I knew a lot about neurology. I had a diplomate in neurology. I had finished a board certification, and I was doing really high level brain and neuro rehab, but I didn't really know a lot about childhood and neurobehavioral issues. And so I started looking into it. But then about 2 or 3 days later, I had my first meeting with a parent teacher meeting for my son, who was in first grade. He was 5 years old, 6 years old. It was one of the first parent teacher meetings I ever had. And we sat down, my wife and I, and first thing the teacher says is, I don't know how to say this, but I think your son may have ADHD or some other type of issue like that. And we were shocked. As a professional, I felt embarrassed. I felt like, how do I not know this? A teacher's telling me this, and I'm supposed to be a brain expert. And as a parent, like most parents, I felt like, okay, I'm also to blame because I'm working a lot and I'm not around enough, or somehow I'm to blame, even though it wasn't my fault. It's not your fault, but that's how we feel. But then I heard my wife say, you're supposed to do something with this. And I believe in messages like that. And the first thing I thought was, well, what's happening in his brain? And I went to some colleagues of mine that I hope would give me a quick answer, pediatric neurologists, neuropsychologists, neurologists, psychologists, pediatricians. And I asked them the question, what is ADHD? What's happening in the brain? And they all looked at me and basically said, I don't know, no idea. And they said, why you ask? And I said, well, my son is, my teacher, and they're saying that he may have it, and I want to try to help him. And they said, well, there's nothing you can really do about it. And I said, how do you know that? You just told me you don't know what it is, but you know that I can't do anything about it? How does that work? And from that moment, I devoted to figure it out myself. And I have spent over 30 years now researching this and publishing research at the highest level and understanding what is actually happening. Just a few months ago, we published the best paper yet that I've published on the neuroanatomy of what's happening in autism. And not that this only applies to autism, but autism is the most complex. It's the most mysterious of all of the neurobehavioral disorders and mental health issues out there. Autism is the most confusing, and that's why most people don't really know what it is. And when you figure that out, then the other ones are relatively easy. And I didn't want to just figure it out just to know what the problem was, but I wanted to know what the solution was, what to do about it. And that's what I've also spent my career doing. And now we're doing it at the highest level. Every day I'm working with people from around the world. And this is, if you're a practitioner, what I'm going to teach you is, what to do about it, what it is, and give you really practical information and why you want to do this and why you want to come to the courses and why you want to learn this information. People that want to do this, that want to go into this field of practice, and you need to learn what the information is. And you need to be able to do two things, one of two things. One is, if you want to build your reputation so that people trust you and they want to bring their kids to you, or patients will come to you, they want to know, again, why should I trust you? Or what do you know? And, you can spend years building a reputation, developing your own brand, your own unique brand, your own approach, or whatever it is. And, that will take years to do. And if you really want to do that, then you really need to do a lot of research to really support what you've done. And that's one way to do it. Another way to do it is to really look for a recognizable brand, a recognizable approach that is been proven to be effective, that already is recognizable, and then learn that and become part of that. And you can still have your own unique identity in your office and your practice, and you can do things, but the way that you do it is you want to be connected with something that's already trusted, something that already is proven, something that has years of research behind it. And that's the Melillo method. That's what I teach. I've spent 30 years developing this. I've worked with tens of thousands of kids directly and indirectly, and adults. I'm continuing to do that now. I've published many, many scientific papers, 8 best-selling books. And I've done the research, and we've done more research this year than any previous year. We'll end up publishing about 10 papers this year alone, and we have many more papers coming out over the next few decades. So this is the reason why you want to do this. This is the reason why you want to become a part of this. You want to become part of a community. You want to become part of something that is, people trust, people know, that has experience. And, again, there are people out there that will say things or make claims. And today on Instagram and on the internet, you can pretty much say whatever you want. And, nobody ever says, where's your research to prove that? Or, how long have you been doing this? Or how many patients have you actually worked with? But you listen it, you hear it, it sounds good. A practitioner is like, I want to learn it. And listen, learning information, learning really complex information, and learning how to do something different in your practice is not easy. This is really important, and it's complex stuff. But I've prided myself on trying to make it so that I try to take the most complex information and make it understandable that not only every practitioner can understand, but parents understand. I have parents that take my course, my full course, and they're able to get through it. And many of them understand it, not because it's simple, not because it's watered down, but because we're able to explain it in simple, complex terms. You know, Einstein said the highest level of sophistication is simplicity. And if you really know something, if you really know it, you can explain it in simple terms. If you have to make things really complex, if you're, blowing people away with your knowledge because you're speaking in ways that they don't understand, it may seem impressive, but it's really because you don't know it very well. So I find that, we really want to make it this something that anybody can really understand and be practical and use it right away. It's not, again, simple stuff. The brain is the most mysterious organ in the universe, but it's also the most fascinating. And I also think there's not a more important thing you can do with your life than to be able to, let's say, take a child who may never speak and allow them to speak, a child that may never walk and allow them to walk, and what that does to the family and the parents and everybody around and society as a whole. And so it's worth the effort. And that's what I want to give to you, or at least the essence of it, when we come to Australia and talk about that. Okay. So, it makes sense that you want to be connected to something that already is out there and proven and can be trusted. Okay, so I think there may be the last question is really looking at, what do we do and what's next? But I think there may be some questions out there that we can answer for you, and really maybe tailor this a little bit more specifically to your interest right now tonight.
Awesome, awesome. Dr. Rob, it's also, look, having listened to you for many years, I always get such a thrill and kick. There's always nuances and nuggets and pearls that I get, and I'm sure that for those that have heard you for the first time, they're probably blown away. And so there's certainly more of an opportunity. We'll discuss that at the end of today's presentation, how you can get in front of Dr. Rob Melillo in November in Sydney this year. But we've been able to canvass some questions from people through our social pages and also through today's Q&A. So I'm going to ask some questions that have come through, have been sent to us previously. For those of you, you can certainly type some questions in the Q&A and in the chat box. But I guess the first question, and one that I get asked most, probably one that you get asked most, is regarding primitive reflexes. And you have such a unique and researched, I've got to say, evidence-based way of integrating reflexes, which I absolutely love. But the first question is, and probably a few questions that stem off this, is what is the best age to address primitive reflexes? Or is it as simple as early as possible?
Early as possible, but that's a little bit more complex of an answer, meaning that you can actually start to see in a 2-month-old or 3-month-old if they're not hitting their milestones in the most appropriate way. And the way that reflexes normally become integrated is through movement. And we have them because we really don't have good volitional control. And it allows us to move. Some of these reflexes will help the baby roll over from back to front and front to back, which is really one of the first things. If that doesn't work properly to both sides, I can almost guarantee you that they're going to have retained reflexes and that they already have a developmental imbalance in their brain. When a baby first rolls over, even the rolling over process, the way that happens, there's a way to go about it. I've been working with this young female pediatrician from Europe, and she's a student of mine, but she's also really doing some great work in looking at early babies. And she works with babies almost exclusively every day, all day. and really refining these stages even early on. And so, like, for instance, when a baby rolls over on their stomach, they should go into this kind of at around 3 to 4 months, they should be starting to get this cobra type thing. So we know that babies have their hands kind of clenched like this. And so we need to get them open. We need that this is part of integrating their palmar grasp reflex. We also know that, this has something to do with if their hands are fisted, they're going to have a higher fight or flight response. So we know that at a certain point, they need to be able to open their hands, push up, and engage their head. And this is part of also the rolling over process with even when they roll over, it starts with them kind of lifting their head and rolling it and then extending it. What we see today is a lot of kids are not doing that from the beginning. We see babies are spending most of their time on their back. According to this pediatrician that I'm talking about, she believes that after 3 months, babies should spend 80% of their day on their belly, on tummy time. And that's not happening. They're on their backs or they're being carried with these things that pry their legs open. And so their legs don't come together. They're not pushing. And as they do that, when they do that, they are activating the symmetric tonic neck reflex. They're tilting their head and rotating it, activating the asymmetric tonic neck reflex, the palmar grasp. And then they go into the marine crawl, which is going side to side, which is activating and integrating the spinal galant reflex. So what we see is that these reflexes are there to get them to move. And then the aspect of moving in the proper way at the proper time is what integrates them. So we can actually assess this as the child is young. I just saw a young baby who's 3.5 months, and this child, the mother brought him to me because she knows the child should be doing a commando crawl or getting to that point. And he's not. He's got like his legs are way too far out. He's kicking his legs, but he's not going anywhere. He's not lifting the head up and extending. And so that's one way where we can look at this. But certainly otherwise, we know, and what our research shows is that if they're not integrated by one, they will never integrate on their own. So they will be present even if you're 50, 60, 70 years old. We can still see these reflexes are there. So the answer is the earliest we can get to somebody, we can identify these reflexes, we can get rid of them. In almost anyone in any situation, within 6 months, we should at least have 50 to 75% of these reflexes integrated. And certainly within a year, we should be able to completely integrate them, if not faster.
So just further to the primitive reflexes, Dr. Rob, many people come to us with having had experience with some form of reflex therapy through different modalities and techniques and different schools of thought. I guess the question is what separates the Melillo method from other forms of primitive reflex work? Given how important it is, as you've described, what is it that makes and how do they form together, with a hemisphericity-based approach? What is it that separates what you do from others?
Yeah, really, there's two key distinctions. I mean, there's many distinctions, but really, even in my own work, in my own journey, as I was taught early on, few decades ago, that, you integrate primitive reflexes by doing different exercises that reproduce the movement, and you do that over and over. And that's all well and good, and it does work to a certain degree. But what we also realized when I was doing my work, as I started working with more and more severe cases of children, let's say on the autism spectrum, what we know is basically, there's such a delay in that right side of their brain that they have a problem feeling their body, connecting their body, and then this impacts their ability to move the body. You yourself, Carlo, have done some really great research and have talked about how, if the vestibular system isn't working and they don't develop this map of their body, you can't control something when you don't know what it is, right? Well, the right brain is really where we know where our body is primarily. That's where we feel it. Interoception, we connect with our internal feelings, and then we also connect with our external body, and then we create a map of how our body is in the world and all of these things. What we're finding is that these kids are so delayed in that aspect. Many of them have a very high pain threshold, or they don't feel temperature, hot and cold, or they don't feel hunger and thirst to the same level. And they don't know where their body is, and they don't gain what we call body ownership. Their left brain is overactive, and that is driving different motor activity and spontaneously kind of releasing programs in their brain. And these are what we see as stims and tics. And you can't have agency or control of your body until you have ownership of your body. And so much of the reasons why kids with autism, let's say, can't speak is partly driven by a nonverbal communication deficit in the right brain, but also a sensory deficit where they don't feel their body. It's almost numb. And because of that, they can't plan the motor movements in the most effective way. And speaking is the most complex motor act that any animal has ever done. And so if they have trouble moving their body, even simply pointing is hard for them to do, then trying to get them to do complex primitive reflex exercises is really next to impossible, and it's frustrating, and it takes a long time. What I've found is that it's much easier to just directly stimulate the reflexes, and you can do that, and you are guaranteed activating the reflexes every time. You can do this whether they're cooperating or not. It takes maybe 5 minutes to go through these reflexes, so you can do it at a high repetition. But the key is you have to use really precise pressure and really precise location. That really needs some hands-on training. That's why it's hard to teach somebody how to do this in the most appropriate way virtually. And that's why I'm coming to Australia, to teach you in person how to do this. And the other thing is that when there is retained reflexes, they're often, most of the time, somewhat asymmetric. So that when there's a delay in development, not only is there this bottom-up, top-down delay, but there's this lateral horizontal delay, and there's an imbalance between networks in both sides of the brain that develop. Those two are intimately tied together, that you're not going to get rid of reflexes unless you address or correct this imbalance. You're not going to get rid of the imbalance unless you actually address the reflexes. They are one and the same. And so most other techniques never look at that whole hemispheric relationship, and they don't look at stimulating the reflexes directly, and they don't understand the precision and the frequency that it takes. So I think those are two key distinctions in my method versus what has been out there traditionally.
Thank you. Another great question, one that you've probably received quite frequently, is regarding the functional medicine versus functional neurology approach. Looking at that gut-brain axis. Many people say, well, you can address many of the mental health concerns by working through the gut and from a bottom-up approach. But obviously, we know that there can be a top-down approach to helping people with many other systemic conditions, including the gut. Where do you see in your work fits with the metabolic aspect and the neurological aspect?
Yeah, I think more and more they're also becoming one and the same, right? So if you know, the title of my course now is actually referred to as Functional Developmental Behavioral Neuroimmunology, because the idea of the nervous system and the immune system and the autonomic system, it's really so interrelated that you really need to be an expert in all of it and understand all of it. I've been doing functional medicine since the beginning of my career, but what I realized was that it really is the brain that drives it all, right? And more now, there are leading researchers that are showing that even things like getting sick, right? What we call sickness behavior, getting a fever, not feeling hungry, not wanting to be around other people, getting malaise, and, wanting to be in bed all the time. All of those things are neurologically driven reflexes that if you cut the vagus nerve, and if you don't have the parasympathetic nervous system, you don't get that. And that there's a reflex, there's an inflammatory, anti-inflammatory reflex that is generated by the brain and the brainstem. that there are areas in the brainstem that are responsible for sickness behavior. There's an area called the parabrachial nucleus, which is connected to the vagal complex, that when we have an infection, that will activate that through the vagus nerve. And then that will go to the HPA axis, and that will activate the hypothalamus and the paraventricular nucleus, which is then what activates the HPA axis to release corticosteroid type of chemicals to be able to reduce the inflammation. And this is all a neurologically mediated reflex. It's not primarily driven. There's been studies that have shown that if you cut the vagus nerve and you introduce an infectious agent, you don't get a fever. You don't get sickness behavior. So this inflammation, anti-inflammatory is a neurological mediated reflex by the brain and by the brainstem. And so what we've been able to show is that that imbalance, that ultimately is an imbalance between sympathetic and parasympathetic nervous system, that inflammation can become actually unregulated, and that becomes the disease itself in many type of metabolic and infective disorders. In fact, the reason why people died from COVID was because they had an increased set point before they got sick, where their sympathetic nervous system was too high. And then what happens is they had unregulated inflammation because the parasympathetic anti-inflammatory response wasn't there. The way the gut works, the gut regulation, the autonomic regulation of our heart and our breathing and our digestion and our metabolic system, it's all regulated by the brain. And now that does have an impact on the brain. Inflammation has an impact on the brain. Infections, yeast problems, chronic gut problems, looking at the Th1, the Th2, and the Th17 system and how they all work. Dr. Peter Schreier, as you know, has been doing a lot of the work with me in my course. And, he's really bringing in a really high level of immunology and functional neuroimmunology. And we're really integrating that together at the highest level. So I think, that's also something that has been an evolution of my journey that I'm really excited about now. And we're really diving into that at a big level.
Awesome. One of the most profound goals that parents have is for their child to be able to communicate. And I think if any of the parents who have nonverbal kids who are watching or listening to us today would say that if only I had my child be able to say something to me, communicate to me, it makes such a difference. We know that nonverbal autistic kids are out there. We know that the prevalence is high. I know this is a weekend topic in itself, Dr. Rob, but what are some of your thoughts on nonverbal, and I guess more importantly, some of the approaches that you would take with the Melillo method in helping address and help kids who are nonverbal?
Well, it comes down to, again, understanding what is actually happening in their brain. Why can't they speak? And, it's interesting. We do a technique. One of the things we do is something called RPM, which is rapid prompting method, which is a way of helping nonverbal individuals to speak by typing on a letterboard. And one of the things that's fascinating is that, we see them doing things and maybe pointing at things and doing it, but they're really not doing it under control, or it becomes almost like a reflex for them. But if you ask them to really try to point to something on their own, it's hard. But if you touch them, or if you put pressure on their arm, they are able to do it. Now, why is that? Because they don't know where their arm is. They don't know where their body is. And they have all these impulses taking over. And by giving them some connection, by simply touching them, or even just touching them on the shoulder or the elbow, they can now locate where their arm is, and they can start to type things out. And I've actually said to many of these kids, where it's unbelievable what they start saying. We had a 5-year-old kid who's never said one word. And he went into the room the other day to do that with his parents, and he typed out 50 words. Parents had no idea that he knew one of them. I believe that things like autism and almost any of these neurobehavioral disorders start with a gift. They start with areas of the brain that are actually too strong. And in the case of autism, it's that left hemisphere. And their language center is great. All the language is in there. And if you've actually even read books by people that have grown up and written books about their experience as a non-speaking autistic adult, they always start with the same thing. I couldn't control my body. I couldn't feel my body, but I knew everything. And it was all in me, but I just couldn't get it out. I had a mom that said to me the other day, I don't know if I believe any of this, with the RPM or any of that, and that they know how to type those words, even though the child did it in front of them. And I said, why? And they said, well, I ask her to do basic things and she doesn't understand me. And I said, how do you know? And she said, because I ask her to do it and she doesn't do it. She doesn't understand. And I said, well, maybe she just can't get her body to do it when you're asking her to do it. And just because she can't do it doesn't mean she doesn't understand it all. And the mom kind of looked at it and said, oh, okay, now that's a whole way of thinking about things. And that sometimes is challenging for some people because, have they been listening to me all along? And one of the things that people with nonverbal will tell us is that what upsets them the most is when people treat them like they're not there, when they talk around them like they don't understand and like they're not intelligent. They're hugely intelligent, and it's all in there, but they're not speaking because they don't feel their body and they can't control the movement, and they don't have the nonverbal piece that often drives them to want to speak from the very beginning. And that's simply put, it's much more complex than that, but simply put, that's what I believe. And even if we ask them sometimes and we say, why can't you speak? I just had a boy the other day and he typed out, I don't feel. Not that he can't move, it's that he can't feel. And that is the main problem.
Well, I think be many parents who are listening today that I think that will resonate so strongly with. We could do this all day. In fact, we are going to be doing it all day, but we're going to be doing it all day in a date in November. And Dr. Rob now will go through, I guess, some of the events that we've got planned for November for both practitioners and parents. And I'll hand over to you.
Okay. So what are the next steps? What are the action steps that you can take if you really want to know more about this and you're really interested? One is I feel so blessed to be able to come there. As you can tell, this is my passion. This is something that I could talk about all day, every day, and I just want to be able to bring it out to the world. If you're a practitioner, we're going to have two primary events. One is going to be looking at the foundations of my work and the foundations of neurodevelopmental issues. If you weren't there, or even if you were there last time when we were there, or if this is relatively new for you, we want to be able to give you, again, very complex information. It's not going to be watered down, but it's going to be delivered in a way that you can understand it and that you can practically use it right away and start making a difference. For those of you that are familiar with my work or really have, a good knowledge of functional neurology or functional medicine, we're going to go through some really cool advanced clinical applications and really bring you up to date as to my research. Like I said, I published more papers this year alone than any other previous year in my whole career. And that's because of the amount of research we've been doing and teaching and also seeing as many patients. So there's very many new distinctions, even from last year to this year. And I want to really bring that to you and bring you up to speed and give you some really cool cutting edge new tools that you can start to apply right away and make a difference. For parents or patients, we're going to also talk about that. But for that, we have the cost is going to be right there, 2,480 Australian dollars there. And again, that will be something that will be available. And then for patients or for parents of patients, we have the Neuroparenting Mastery, where really we're going to give you a lot of information on what's happening with your child. Again, answering some questions that no one else has really answered for you before, but also giving you tools, really working with you hands-on on how to do some of these things like primitive reflex integration, talking about the developmental stages and how they look and what they should look like, and just answering questions for you, and really just trying to give you as many tools as we can on understanding your child or yourself and being able to allow you to make a difference. Because the bottom line is, in most of our patients, we do a lot of work in our center or virtually, but the majority of the work is done by parents, and we train them how to do that. And we look at, when we work with people, that part of it is working with the child and treating them or the patient, but also it's about training the parents or therapists or the patient themselves how to help themselves. And so that is Australian's going to be for one person, $590. If you come as a couple or there's two of you, it's 1,180 Australian dollars. So this is something that I think is going to be well worth it for you, that you're going to get a tremendous amount of information. And if you actually are registering now for this, I've also created a 3-hour introductory, but pretty high level functional neuroanatomy course. This is a course that I've done a really super advanced functional neuroanatomy course that is 5 modules and is over 50 hours of material. But what I've done is I put together approximately a 3-hour introduction to really understanding the neuroanatomy of the brain from a functional perspective, and being familiar with some of the terms that we may be using. And whether you're a practitioner or whether you're even a patient or a parent, it's going to be understandable, but it's also going to give you a leg up so that when you do come to the lecture or to the presentation, you're really going to understand, and you're going to be starting from a different place. And normally I charge $199 for that, and this is, for courses, but for anybody here today, this is going to be free. So this is a free introduction to neuroanatomy. It's going to give you a really good background, and it's going to prepare you for my trip there. And what we also want to do is we really want you to be able to take action and really be able to, make a decision that you're going to do this. It really comes down to action. Those are the things that define you. We want to also, if you register now or in the near, within a short period of time, we're going to take the normal fees for the advanced clinical application and the neurodevelopmental foundations and for the parents, and we're going to cut those costs, and we're going to make it even more affordable. So it's going to be $1,872 for practitioners. For patients or parents, it'll be $490 for a single ticket, or $790 for a couple. I think this is a very, very good deal because the value of the information you're going to get is literally priceless. There is nothing more important. And we're going to be giving you tools to not only boost your practice and help your patients, but also, we're going to give patients and parents tools to help themselves and help their own children, which ultimately will save you tremendous amounts of money in the long run. I just had a parent the other day who just put her 15-year-old son in a institution, a long-term institution. And she came to me, and she was a professional, believe it or not. She was a chiropractor. And for some reason, she's from New York and she hadn't been familiar with my work. But she told me that she spent $2 million on her son, and with no real benefit. So there's a difference with spending money. There's a difference with spending money and getting a real value for it. And ultimately, that can actually save you a lot of money in the long run. So I think this is a really good value. And that's what I'm about. That's what Carlo's about. My main driving force in life is to add value. And that's what I want to do. And I think that is what we want to do. That's the reason why I'm traveling there. We just want to add value to your lives, to your family, to your children, and make a difference, and give you this opportunity.
Awesome. Well, there's certainly great value in what you've provided, Dr. Rob. So thank you so much. For some of the questions that people have had about, do you get the access to those to the free course if you've already registered? Yes, that will be provided. One other thing that I think is really, really worth mentioning, um, for those that are registered for the or registering or have registered for the parent mastery event, we are making available a single and one only um, possibility of seeing Dr. Rob or having Dr. Rob see your child for a full consult. Now, let me be clear on this. The value of that is significant. There's only one available in Australia. Dr. Rob has a very tight teaching, clinical, research schedule. We're unable to hold him down here in Australia any longer, despite my best efforts. All right. But he is making available a single assessment for one person. This person will be announced closer to the event, and it will only be available to someone who registers for the parent event. So if you were registering as a couple, you have two chances of having your name pulled out of the hat, so to speak. So if that's not an incentive enough, I really don't know what else is. So there's so much to look forward to. We've got a lot to cover. That one day with Dr. Rob will be an opportunity to mingle with other parents. We know how isolated these conditions, the community can be sometimes. So I think mixing with other parents, again, is huge value. Building a network of like-minded people, speaking with practitioners that can help, having a chance to meet and ask Dr. Rob himself questions, sitting in his lecture. I mean, there's so much available that I think could be well. I think it's obvious that we should all be suggesting and recommending this for parents. That's available for practitioners. We've got multiple uh, courses that are available, as Dr. Rob has mentioned, from the foundation to the advanced, but certainly something that you want to grab onto, because we're not sure when we'll see Dr. Melillo next in Australia. But look, I think we've got to wrap it up here. It's been a fantastic hour, as it always is, Rob, having a chat with you. I hope you've enjoyed it. Just from the comments and the number of participants, the number of registrants for this event, and the amount of people that will see this, we're definitely going to be spreading the word about your work and the opportunities and the possibilities parents and people have to know more about your work.
Well, I've enjoyed this immensely. I enjoy any time I have with you, but also with the people in the comments I'm seeing right now. Thank you very much. You're all thanking me. Thank you. I appreciate your time and effort, and I hope I get to meet you in person. I'm looking forward to being in Sydney.
Fantastic. So the link for the event is posted in the chat. You can see it there. You can click on that to take advantage of some of the offers. Obviously, our social media pages and the website and the Brain Hub Academia website has it listed for further details. And you can certainly email our centre for any questions as well. But anyway, let's wrap it up. I know it's late in New York. You've had a long day, no doubt, as you always do. We thank you again, and really we can't wait to see you in what are the dates now? In about 8 to 10 weeks time, we'll be seeing you again soon.
Okay, great. Thank
All
you.
right, you take care. Thank you so much. Thank you.
Okay.